Welcome to Thursday Thought Leaders with Harbinder Narula on BW Healthcare World. My guest today is Ms. Sumita Mohapatro Pani, who is a passionate pharmaceutical professional with over 28 years in the industry. She currently serves as a Vice President Lupin and has led the launch of Atharv Ability, which is a multidisciplinary neurological rehabilitation outpatient facility for adults and children. Atharv provides rehabilitation for conditions such as stroke, TBI, SCI, and other neurological conditions such as Parkinson's, cerebral palsy, multiple sclerosis, pediatric neurological conditions. Sumita, other than having launched Atharv at Lupin, is also the Vice President and the Head of Business Development at the group level. She manages in-licensing and business ethics at Lupin. Let's speak to Sumita about Atharv, which she had created and launched for Lupin. So welcome to BW Healthcare World, Sumita. Thank you so much for taking out time to discuss about Atharv as well as about your own journey. Before I get into what Atharv is doing, you spent 28 years in the industry. Would love to know about your journey in the business of healthcare.
First of all, thank you, Mr. Narula, for having me here. I started the business in healthcare at a very young age, just after my graduation in zoology honors, Miranda House, Delhi University. I had just finished up with my exams and I was waiting for my results to come in. And I was also applying for my post-graduation in, anthropology and genetic engineering. And that was the time I saw an advertisement in the newspaper, Lupin, calling for a walk-in interview. So I walked in for the interview very casually, and after that I forgot about it. I came back home, and after about 10-15 days, I received a telegram, and the telegram read, you have been selected and you have to join for training at Mumbai for 45 days. I had not spoken about it to my parents, at that point in time, and I broke this news to them, and they obviously wanted me to pursue academics. And I said, look, I have no intentions of joining, but I would like to attend this training because I would like to see how this corporate training is. And I had never seen Mumbai before. I was in Delhi then, and I would like to go there and see. So I went there, and something changed during the training program. I don't know what. And I changed my mind and I decided to pursue my career. I came back home and I broke this news, and it's been 28 magical years since then in the healthcare industry. I would say that these 28 years, I've seen the industry transition. I've seen the organization transition. Back then in 1990s and 2000, the burden of diseases in India was basically infectious diseases. And that was the time, India was transitioning from the infectious disease to the chronic diseases in terms of disease burden, and the entire industry's focus was, getting into the chronic segments. And that point in time, you would know probably that Lupin was synonym in anti-TB portfolio, and we were absolutely the global leaders. We were the Indian leaders and synonym with the anti-TB, and we also decided to get into the chronic segment. And I think I feel I've been very, very fortunate that I was one of the key core members to drive Lupin's foray into the chronic segment, especially cardiology, and driving it to the leadership position where it is today. I've been also quite instrumental in the diversification of Lupin into the other chronic segments other than cardiology, like diabetes, neuropsychiatry, oncology, nephrology, etc. Currently, I am responsible for getting innovative patented products to different therapies in India. That definitely shapes and is the lifeline of growth for any organization per se. And Lupin is now transitioning into overall healthcare spectrum, where we can impact the overall health outcome of the patients beyond medication. And again, I'm very, lucky to be a key part of it, and Atharv being one such initiatives.
Awesome. It's a beautiful journey of the last 28 years where not only you have evolved, as a person, but the industry has evolved. But what is really beautiful is to see how Lupin is keeping pace with the evolution of the industry and becoming relevant at any stage. Sumita, how did the idea of creating Atharv came about? It's very different to what typically Lupin has been doing in the past so many years. What is the objective behind setting up Atharv Ability Center?
So, Mr. Narula, for Lupin, patients are at the heart of all activities or all initiatives that we do. So here the objective was, how can we improve overall health outcomes of the patients, especially in the neurological space, especially with the patients with neurological disabilities, and reintegrate them back into life. So with this strong objective and I would say a very strong purpose, we undertook a thorough research to see what is today available in India, what is the need gap, and how can we shape it up. And, we found that neurological disabilities, they contribute the highest to the disability adjusted life years, which essentially means number of healthy years lost because of a disability. So globally, it is 6.5%, which is higher than any other disease condition, be it ischemic heart disease, be it respiratory, TB, or any other disease. In India, it is still higher at 10%. Now, you would be surprised to know that post-stroke patients, post-stroke, there are 60% of the patients live with some or the other kind of disability. TBI patients, which is traumatic brain injury, SCI patients, which is spinal cord injury. These patients post an event, more than 50% of them, they live with some kind of a disability. And these disabilities are in various forms. This can be paralysis. This can be, problems with swallowing, which is dysphagia. Problems with speaking, language, and comprehension, which is aphasia, and the cognitive disabilities, etc. Now, because of these disabilities, the patients tend to live an assisted life, even for their day-to-day, things. So the idea was that how to, empower these patients to do their normal activities, to help them resume their cognitive and functional abilities. So this was the very strong idea about setting up objective, for neurodisabled patients. You would see that the tagline of Atharv is Ability, Dignity, Life, which essentially means what we intend to do is to maximize their cognitive and functional abilities which they would have lost because of an event. And dignity is such a big part of it. You would know that if somebody is not able to do their day-to-day activities like buttoning a shirt, toileting, or personal grooming and hygiene, so dignity is compromised somewhere. So our endeavor is to give them back their dignity and reintegrate them back into their lives, because ultimately life is beautiful.
That's such a beautiful initiative, Smitaji. How will Atharv Ability Center transform India's neurological disorder treatment? Because you're triggering a change. using innovation and innovative use of technology which is available. So how do you think this will transform the neurological disorder treatment in our country?
So, Mr. Narula, to just simplify, I would say that what are the neurological disorders and disabilities arising due to the neurological disorders? So, very broadly, I would bucket into three parts. So, one is neurological. A patient is born with a neurological disorder and disabilities because of that, like cerebral palsy. Second bucket is when a patient undergoes an event during the lifetime, such as stroke, which is also called as a brain attack, or a patient meets with an accident and has injury in the brain, like traumatic brain injury, which leads to a neurological disability. Or a patient injures the spinal cord, leading to a neurological disability. And the third bucket is the aging patients. Now in India, the population is aging, and there are progressive diseases like dementia, Alzheimer's, where there is a cognitive decline, and there are diseases like Parkinson's, where there is tremors and movement disorders. So these are the three buckets of neurological disorders and disabilities arising out of that. Fortunately, Mr. Narula, we have excellent neurologists and neurosurgeons in India today to treat such conditions. Our healthcare has also evolved over a period of time, especially in the metro cities, to treat such conditions. And in India, for treating such conditions, the medications are also on par with the international standards today across the spectrum of the neurological diseases. However, unfortunately, such neurological patients, despite the best of medication, best of doctors, best of healthcare and interventions, they can take them only to a certain level. Because such patients, the fact is about 50 to 60% of them, they live with some kind of disability. And I have just shared that what kind of disabilities they live with. And rehabilitation is such a big part of their full well-being. So here is the gap that arises. In India, there is lack of awareness. There is lack of a place which gives comprehensive neurological treatment, different types of neurological treatments under one roof. There is a gap of highly trained and qualified doctors. And of course, affordability, accessibility is all an issue. So we would like to transform the space of neurological rehabilitation by addressing all of this. So we intend to, have Atharv Ability, where we have multidisciplinary modalities like neurophysiotherapy, speech therapy, occupational therapy, aquatic therapy, all of that under one roof. So the patient doesn't have to move from one place to another for different types of services and drop one of the services meanwhile. So we want to provide everything under one roof. Second, it's very important that we work on the awareness part of it, on the benefits of neurorehabilitation. And of course, having it accessible to more number of patients. For us, every patient that requires a neurorehabilitation must have an Atharv Ability for him. And of course, affordability is something. So by addressing this, we would like to transform the neurological rehabilitation space.
Absolutely. I think, it's in line with what I say, that there are three pillars to making a difference in the healthcare. It is creating access by providing the services. Second is ensuring quality. But both of these have to move to the third pillar, which is affordability. And I guess that's
Absolutely.
what you're doing.
Absolutely.
And Sumita ji, you spoke about the need in our country, but you have your center in Mumbai. What is your plan? Is Lupin planning to take it to other parts of the country as well?
Yes, of course. So like I said, our intention and purpose is that every patient with a neurological disability that needs neurological rehabilitation must have an access to Atharv Ability. So Mumbai Center at BKC is our maiden center, and we do have plans to have more such centers across the country, so that people get quality services. And very shortly, I think we are already working on 2 more centers as next step. So Hyderabad is one, and New Delhi is the other one, which should be coming up shortly.
And Sumita, what kind of an investment is Lupin making in Atharv Ability centers? And is this more of a business opportunity that exists, or is it a strategic move for Lupin?
So, we don't break numbers as such, but I would like to say, when we are talking of investment, we have done adequate investment to ensure that the patients with neurodisability get the best quality services. Like, we have invested immensely on choosing the right rehab experts. I'm very glad to say that our team is like one of the best and handpicked. They are well trained and qualified neuro rehab experts. We have, Dr. Gaurish Kekre, who's quite well known and probably one of the best in the neurophysiotherapy space. We have Dr. Amrita Paranjape, who is like the best in aquatic therapy. We have Dr. Snehal Deshpande, who is one of the best in pediatric rehabilitation, and so on and so forth. So our team has been handpicked, and besides their qualification, training, and their skills, I think they all are very empathetic and patient. So a lot of investment in choosing the right people, choosing the right equipment, best in the class equipment. So the mandate was get the best, whatever is the best, more evidence-based across the world we have to get. So we did a lot of research on getting the best equipment, best in class. And you would have also seen that our center is at the prime location in Mumbai, which is in BKC. And it's spread over, over 12,000 square feet and quite spacious. In city like Mumbai, it's a difficult site to have, such a big setup for this. So that is the kind of investments that we have worked on.
And, if you were to look at it, is there any other facility in the country which is similar to what you are doing, or are you the ones who are innovating and creating a difference in this space?
So I commend everyone, every neuro rehab center that is there today in India, because anyone who is working in this space has identified this big need gap. So I commend everyone. However, I would like to say that, we have researched quite a bit to get the best and to address, what the patients could face. So this is one center where all the therapies are under one roof. So we have, multidisciplinary therapies like neurophysiotherapy, speech therapy, occupational therapy, aquatic therapy, which is one of its USP, all under one roof. We also have, one dedicated space, which is a simulation of a home environment, which is activity of daily living. Like I said, that these patients cannot do their, activities of daily living like they should be doing. So they are trained. There is a complete house simulation where they are trained on how to get on a chair, how to get on the bed, how to move out of the bed, toilet training, etc. So we have everything under one roof. So that is definitely one differential which saves patient from traveling from one place to another. Any which ways they are in trouble and somebody has to assist them for traveling. So that saves them from that, and everything under one roof is such a big relief to them. Secondly, I said that, our rehab experts are so well trained and qualified. So we have, as per these services, we have selected the people with the relevant qualifications and skills and train. Thirdly, you would see that our space is such large space, 12,000 square feet, where patients can interact with each other, because it's so inspiring for one patient to see another patient doing well and get inspired from each other. So there are open spaces, interactive spaces. We have absolutely world-class equipments, the best in class in each space. And entire architecture of the setup is based on the neuro architecture, where the colors are soothing, the flooring are patient friendly. You'll see we have all the walls that are rounded walls. The passages are broad, so that patients can move without touching each other. Wheelchairs can move easily. So all of that have been kept in mind. So I think that's the difference.
Awesome. So it's been very well thought out to establish this particular space. One would assume, Sumita, that a place which is in central part of Mumbai, such a huge space with the world-class equipment, would be very, very expensive, to access. Now, how is the affordability part for the patients who are using this facility?
Like you rightly said some time back, quality, accessibility, and affordability, these are the key elements of any initiative to reach it to the, relevant people. So, our prices are quite affordable, I would say. So our sessions of neurophysiotherapy, speech therapy, occupational therapy, etc. are priced at about 1,800 rupees. For 45 minutes to 1 hour session. And there are packages of, if a patient is coming for more number of sessions, at attractive discounts as well. We have interesting concept of daycare as well, where the patient can stay the full day at a cost of only 5,000 rupees at bundle services, as per the requirement, customized for the patient. And we have advanced robotics, that are aquatherapy, that are priced between 2,500 to 3,500. So the costing is pretty much benchmarked with what is there today here in India, and I think it is pretty much affordable for the kind of equipments that we have and the kind of people who we have that deliver these services.
Right. And Sumitaji, how are you using technology at the center? I know you have the best-in-class equipment, but are you using some kind of AI-based tools to treat the patients? What are these tools that you use, if you use any, and what is the impact that you are seeing of using AI tools to the effective patient outcome?
I think very important question, and we have to keep up with the time and technology being everywhere. So, we have been very, very diligent on selecting the right kind of equipment that is modern in all way. In fact, I'd like to share that, I've visited the neuro rehab centers across the world, the best across the world, like Shirley Ryan in Chicago, Spalding, in Boston, Rush in Chicago, then NCH in Naples, to see what they have. And I'm so very glad to say that our equipments are as good as them, or even better, because these are the latest ones. So we do have very technologically advanced robotics that are very evidence-based. For example, we have an equipment called Lexo, which is for gait training. It is end effector based robotics. So end effector typically means that the end part of the body is in the touch with the sensor, and the machine judges what is the capacity of the patient and uses different kinds of modes like active, passive, or assistive. So first it would start with passive, where equipment would work more and patient will work less. As the patient progresses, it will automatically judge that how much patient can be involved, and it will get into a active mode of the patient or as assistive mode and then move to an active mode. It will also create the virtual environment, like walking on the sand, walking on the road, for them to, get used to when they come out to the world. It also gives, live performance recordings that how they have done. So it's very, very interactive. This is for the first time in India. Then we have Diego, which is for the upper arms. That is also very interesting and interactive machines, which has intelligent weight systems and interaction, and which records their performance, gives feedback, etc. Very importantly, you would see that most of the places would have something to walk, the gait trainings and the hand trainings. What are missed out is fingers and thumb, and for our day-to-day activities, they are so very important. So we have another equipment that specially takes care of the spasticity. You would see that patients of stroke, their fingers are like this, tone. The tone is these spastic fingers. So there are equipments that strengthen these fingers and improve the range of motions, etc. So we have very, very interactive equipments, absolutely world class, where AI is used, technology is used, and patient can monitor their progress, doctors can monitor their progress, and they can work towards the better outcomes.
So Sumita, what's next at Atharv? How are you planning to scale this?
So we all are very passionate about it, Mr. Narula, I would say, and we definitely are looking at more centers across. As like I said, immediately we are working on 2 more centers that should be coming up. It is a continued process. We also want to carry out studies to see the outcome measures, how the patients are getting better. We already have a very good patient pool, and we really want to see that how the patients are transforming and reintegrating back into their lives, and how we at Lupin, at Atharv, can impact their lives meaningfully.
And Sumita, we've spoken about Atharv and Lupin's strategy. Thursday Thought Leaders is about you, right? So what is your personal passion, and how does it align with what you do professionally?
Okay. So, Mr. Narula, I would say that I'm a very, very passionate person. I'm in general in love with life. And I like to live every moment. I like to make the most of it. And I do realize that this is only possible when one is, mentally fit, one is physically fit. Otherwise, it's not possible. However, you want to make the most of the life, if you are not mentally fit or physically fit, you can't. And I'm in an industry that, makes people live longer with new therapies, new treatments, new medications, new services. So I think the industry is beautiful. That makes people's life beautiful, or allows them to live it beautifully to the fullest. And that's where my passion and my work align.
And Sumita, what are your hobbies? What is it that you like to do when you are getting some free time, if you do get some free time?
There are many hobbies, but I do believe that dressing up is a big part of me, I would say. So I believe that every time you walk your door of the house, you should be impeccably dressed, and you should look the part, and it is very important. And I do believe that you can get everything if you have dressed the part, and quite literally and figuratively, I would say. But apart from this, I do try my hand at colors. I like to play with colors. So I like to paint. So whenever I have time, I do paint. Yes.
Awesome. So would it be okay to assume and say that if Lupin had not happened in your life, you would have either been an artist or a fashion designer?
Yes, I think you can, you can do that. So that's my creative side of it. Apart from the business acumen that I have, that's the creative side of it.
Awesome. Awesome. It's absolutely brilliant to see that, certain passions and hobbies in your life actually play a very important role in how you do whatever you do, whether personally or professionally. And that's quite evident when we look at you and speak to you. Thank you so much for speaking to us at DW Healthcare World. What I noticed is that everything that you are doing is very well thought out. Like you spoke about the rounded corners of the walls, or even the tagline, where you are not talking of disability, you're talking of ability. You're talking of bringing back the dignity to people so that they feel good about living, and that is where the life comes in. Also, something that I observed and I would like to share with you here is the large part of what leads to success is accepting change and then participating in that change and make it a part of your life where it leads to a part where you start triggering change and bringing innovation in whatever you do. And what you are doing at Atharv is actually changing the patient outcome, not just at the surgery where patients are, they're given the treatment and then they're left to recover on their own. You're actually enhancing and speeding up the recovery process. So you're becoming a part of their life after the initial treatment has been given, which is a very beautiful part of what you do. So thank you so much for speaking to us. It's been a pleasure.
Same here, and thank you for having me. Thank you again for giving me this opportunity.